Hello, welcome everybody. I'm gonna give it just another minute or two, let people jump on here and we'll get started. All right, let's get started. Happy Monday, everyone. This is GLP-1s and other weight loss methods brought to you by Archimenides Group. My name is Rachel Edwards. I'm a registered dietitian with Arch, and I'm based out of Seattle. I've been with the company a little over 6 years now, and I'm very excited to chat about this topic today. It's something that has blown up headlines all over the place in recent years. GLP-1s, specifically, we're talking about the medications, GLP-1s, and there's a lot of opinions about it. People really kind of float in two different camps of like thinking these are great or that they're terrible. So I hope this presentation brings a little more nuance because it seems they can be really effective for some populations and not for others. So I hope we can learn more about them today, as well as other weight loss methods, if that's a journey that you are taking. So with that, let's get started. I'm going to start with the willpower myth. Whenever we're talking about lifestyle changes, nutrition in particular, there's still very much this idea that we should be able to willpower our way through changes. And it really underestimates the effect that biology has on our ability to make changes. Sorry, I'm just going to mute everybody real quick. Awesome. So when we're looking at hunger, it's hormonally regulated. It's not just a choice. And willpower decreases when we're chronically stressed or if we are in periods of deprivation, whether that's food deprivation or sometimes even just psychological deprivation. If we're telling ourselves constantly that we can't have something, something is bad, it makes it much more difficult. Sorry, I'm going to go ahead and mute everybody. But if you have a question, please throw it up into the chat. Thanks, guys. So sometimes when we're in deprivation, whether that's physical or psychological, it makes willpower that much harder. And I think anyone with young children knows that when you're sleep deprived, that kind of chronic stress, it makes it very, very hard to make changes. And often biology overrides our intention. Hunger signals are extremely powerful. Leptin, ghrelin, insulin, all the things that affect our hunger and our blood sugar have a lot more power over than our choices than I think we want to think. Social eating environments also affect the food choices that we make, how you grew up, what kind of foods were available to you, what kind of rhetoric was around foods. If you had, authority figures who talked about weight and body constantly, that's kind of a mindset that can lead to deprivation later in life. Food availability and cost. We're more likely to overeat if we're not exactly sure where our next meal is coming from or our next healthy meal is coming from. Highly palatable ultra-processed foods definitely have an effect on how much and what we eat. When we're removing nutrients that help us feel full and satisfied and really packing in nutrients that hit those reward responses in our brain, it's absolutely harder to stop eating. And gut microbiome, all the bacteria that's in our gut, something that we've been building since childhood, doesn't change overnight. And everyone's gut microbiomes are very different based on a lot of different factors, but that can change how strongly we feel hunger, how strongly we feel fullness. So not everyone is starting from the same place. When we're looking at hunger, when we're looking at ability to make lifestyle changes, it really is a little bit more nuanced. So we know weight is influenced by biology, environment, psychology, access, and something else to note here that I think is important especially when we're talking about weight loss, is that body size and health are not the same thing. But we very much have that idea uh, from all kinds of messages through society that thin is healthier and fat automatically equals less healthy. And that's really not the case. Body size alone is a pretty poor standalone health marker. There's plenty of thin people who have poor metabolic health and plenty of people in larger bodies who have excellent biomarkers. So I think that's part of the reason we know, and research has shown, that weight loss by itself doesn't improve our health. It has to be the particular people losing weight, right, who can metabolically benefit from that, and how they lose weight and the rate at which that weight loss occurs absolutely matters. That being said, obesity itself is associated with increased risk of metabolic diseases, but not perfectly fitting into maybe your ideal body weight is not the same thing as, obesity increasing our risk of chronic disease. So putting that nuance in there is important. So let's dive into GLP-1s. GLP-1s are the class of medications that were approved in 2021 for weight loss. They've actually been used for many, many years before that as a diabetes medication. And they actually mimic a hormone produced in our gut that helps us increase insulin secretion in response to meals and blood sugar levels. It slows down stomach emptying, so in that way slows our digestion down and can help us feel fuller longer. So it also has a direct link on suppressing our hunger and can block the reward response of food, which is really interesting, and we'll get into some effects of that later. There's 3 medications that are currently FDA approved for weight loss, including Ozempic, also known as Wegovy, Victoza, also known as Saxenda, and then Mounjaro or Zepbound. Different names, really depending on what they're being used for. I think that's mostly for insurance purposes. Average weight loss on these medications has been 10 to 15% of body weight lost in 12 months, so they are absolutely effective. And it's highly recommended to avoid compounded medications as they are not FDA approved, and harmful side effects have been reported, particularly, I think it was 2022 when there was a shortage of the FDA approved medications. So a lot of people were going to compounding pharmacies or ordering online, and they are not the same thing. So just be aware of that if you're looking at those different types of medications, whether it's to save cost. There have been harmful side effects reported, so be cautious of those. Um, there's a list of people who are contraindicated for taking GLP-1 medications, particularly those with inflammatory bowel diseases or gastroparesis, if you're pregnant or breastfeeding, a family history of thyroid carcinoma, diabetic retinopathy, history of pancreatitis, and then disordered eating. That's one that can get a little complicated, especially if someone does have some metabolic markers that could benefit from weight loss. So something to work closely with a doctor on. So these medications have been really interesting in recent years. They're a lot of potential benefits. So this is a study that just came out about a year ago, mapping the effectiveness and risks of GLP-1 receptor agonists, so the weight loss medications. This is an observational study where they took from a database over 1 million people with diabetes, some of them taking traditional diabetes treatments, and then some of them were on the GLP-1 medications. And they found that those on the GLP-1 medications had a reduced risk of substance abuse and psychotic disorder development, reduced risk of seizures and neurocognitive disorders, including Alzheimer's and developing dementia, reduced risk of coagulation, cardiometabolic, infectious disease, and respiratory conditions. So this is a very exciting study. These kinds of numbers, disease risk, I don't know if I've seen anything that has shown that since they followed the Mediterranean diet 10 plus years ago. So just an observational study. There's ongoing research right now to establish what level of risk reduction that this can really show. But it's not just a weight loss medication. This medication is primarily for improving metabolic markers of health. So potential benefits. So in that landmark study and other research has been showing potential improvements in brain health, heart health, liver disease, and sleep apnea. But it's important to note that those benefits are particularly shown for those with either diabetes or obesity. Those improvements have not been shown for people at a slightly above normal or normal body weight who are on the medications for weight loss. The addiction treatment is interesting. And then something that the medications also do is reduce food noise. So they really reduce cravings. So in that way, they can potentially make choosing more healthy, balanced meals easier. But for most of these benefits, it's only been shown in those with either diabetes or obesity. So brings us to another interesting point with GLP-1s, something called vanity weight loss, or what's been referred to as vanity weight loss, where maybe someone isn't in need of like metabolically beneficial weight loss, their cholesterol, their blood sugar is fine. Maybe they don't have a lot of weight to lose, but they're interested in losing weight. Noting health benefits have been seen in people with metabolic dysfunction, not for those who just have a few pounds that they could or want to lose. There's been limited benefits shown in those who are already healthy. And the treatment's pretty new. Effects of its use of over 10 years of use are unknown at this point. And so it's important to chat with your doctor. Risks may outweigh the rewards of a few pounds. It's another good note to be cautious of online ordering or compounding pharmacies, because it definitely is a conversation to have with your doctor to see if these are right for you. So lots of potential benefits, especially for those with metabolic disorders on these medications, but there are risks as well. And regardless of whether you're on a GLP-1 medication, losing weight really quickly is usually not the best way to go about it because there are risks involved, mainly losing lean muscle mass. So when we lose muscle, we not only don't feel as strong and see visual differences, but it can destabilize our joints, lower our energy, lower our immune function, increase risk of falling, particularly for older adults. So we don't love losing lean muscle mass. Fast weight loss can also lead to nutrient deficiencies, gallstones, increasing risk for neuropathy, hormonal dysfunction, energy, mood, and of course, rebound weight gain. So regardless of medications, whenever we're losing weight really quickly, it's harder to sustain that weight loss, and we do increase risk for certain health issues when we do it that way. I think sometimes we especially if you have weight loss goals, we want to lose it quickly. We want to get to that goal as fast as possible. but that's not always the best way to go about it for your overall health. Risks of GLP-1s themselves, there are a few more beyond quick weight loss. There's a lot of GI issues that they see with the GLP-1s, so nausea, vomiting, diarrhea. Often these can be mitigated with the right dosing and working with your doctor. But if it's really persistent, dehydration and kidney problems can occur. And then something dietitians are really interested in and that we're seeing is that people aren't eating enough on these medications if they're not working with practitioners. And malnutrition brings on much more urgent problems than someone who's maybe eating a little bit more than they need to. Malnutrition absolutely increases our risk of chronic diseases. And when you have, less calories to work with, the food choices you're making become a little more important to get the nutrients that your body needs to function. So not eating enough or not changing food choices if they need to be changed can be a problem for malnutrition. Risk is low, but with GLP-1 use, pancreatitis risk increases, gallstones mainly related to the rapid weight loss, right? Only in animal studies have thyroid tumors been shown. That has not been seen in human studies, so grain of salt there. And then muscle loss. This is bigger than strength, right? We know it increases fall risk in older adults, can lower our bone mineral density, our energy, and our strength. Also, something interesting they saw with GLP-1 use is it can increase the risk for arthritic conditions, which is curious because a lot of, or some studies have shown that losing weight can decrease the pressure on our joints, right? But that isn't true if the weight that we're losing is muscle, right? Because muscle helps stabilize our joints. So if you're losing weight quickly and losing a lot of muscle, you're actually increasing your risk for arthritis. And then, of course, with GLP-1s, eating disorder risk is a concern. It can be really empowering to have more control over our weight, but sometimes that is a slippery slope into obsession, or being able to control that weight can be a slippery slope into eating disorders. So while some can benefit from medical weight loss, sometimes weight-centric care and focusing on the weight by itself is not always helpful. It can harm not only our physical, but sometimes our mental health. Increasing anxiety and body shame can lead to disordered eating. Fixation on weight and food restriction can make long-term success more difficult. Our body, it has lots of biological drives, right? If we're constantly feeling deprived, then we're going to be more likely to fixate on that food, increase our hunger hormones. It's going to make it harder to maintain that weight loss because our bodies aren't necessarily used to living in a food abundant world, right? We're biologically still in, more of our ancestors' times where food was more scarce. So your body's always trying to prioritize making sure you get enough food. So sometimes when we're in those states of deprivation, whether that's physical or psychologically feeling deprived of food, can make it much more challenging. Health behaviors should be more than what's on the scale, right? Focusing on improvements in our sleep, our strength, our metabolic labs, energy, mood, all of this should matter more than just the pounds on the scale, right? And we know this is true from crash diets. When people focus on weight loss alone and they don't focus on nutritional adequacy or making lifestyle changes that they're able to sustain, rebound weight gain occurs. We don't see the health benefits for them. Sometimes it's helpful to focus on what food can do for our body, the function of it, versus the weight loss itself, how we think it might make us look. That being said, there are definitely some things we can do if you are interested in weight loss, or it would be beneficial for you, and maybe you don't meet the criteria for GLP-1s, or you just want a more lifestyle approach to weight loss. These are some methods that have been shown effective for weight loss and maintaining that weight loss in particular. Any diet can be turned into a fad diet if we do it without the right intentions, right? If we're losing weight really quickly, if we're making really big, drastic changes to our diet, often those things are less sustainable, can make us hungrier, more tired, much less likely to maintain that weight loss. Calorie cycling is something that can be effective. So this is a strategy typically where people will take 5 days a week of a calorie restriction and then 2 days a week where they eat maintenance or above maintenance level calories. It's more sustainable because people feel less restricted, and it also helps maintain our metabolism versus when we're constantly restricting calories day after day, week after week, without any days that we're at maintenance level. Gradual food choice change. So we know when we make big, huge changes to our diet, it tends to be less sustainable. Working with someone on gradual changes is more effective typically. Mindful eating and intuitive eating, these are concepts with a whole list of strategies in them that can help you improve your relationship with food, as well as they can help with weight loss goals too. Coping strategies for emotional eating, stress eating, bored eating. This is something GLP-1s can't fix if we have food as a coping mechanism for different reasons. Looking at alternative coping strategies sometimes is much more effective than focusing on the food itself. When we make nutrition changes along with cardiovascular and strength training exercises, those tend to yield the best weight loss results, more sustainable, and more muscle maintenance. Increasing our sleep quality. Sometimes we're hungry because we're sleep deprived. That's big with new parents, right? If your kid is up all hours of the night and your sleep quality is poor, you're going to be hungrier, your willpower is going to be lower. It's going to be harder to make meaningful nutrition change. So working on sleep quality, or sometimes waiting to get out of those periods of life can be a better focus point for nutrition changes. Improving relationship quality. If we know there's loneliness epidemics out there, if relationships in our life are suffering, that can absolutely affect our eating habits. So GLP-1s are best used in combination with lifestyle changes. Sometimes lifestyle changes are a better fit, just depending on the person. GLP-1s are great for reducing excessive hunger signals, improving our satiety and insulin regulation. And there's potential metabolism benefits with GLP-1s as well as the disease reduction. They fall short on improving social eating patterns, nutritional adequacy, making sure we're getting enough nutrients our body needs with those minimal calories that you're able to eat on a GLP-1. Improving our relationship with food, GLP-1s can't fix that. Sometimes they can help by reducing that food noise. Muscle preservation and tension is needed to preserve muscle. Not only enough protein intake, but exercise as well. If we're not using those muscles and you're losing weight, you can bet you will have some muscle loss. And then more studies are needed to establish long-term use risk. Again, a lot of the research is about 10 years beyond that. It's pretty unknown what long-term use risks could be. And often when we start medications like this, it can be very difficult to come back off of them. Often there is a long-term care plan that goes along with them. But at the same time, the research is exciting. It can be really beneficial for some people in improving their long-term health, their longevity, potentially reducing their risk for other chronic diseases down the road. So there's definitely benefits that can be seen beyond lifestyle change alone for people who fit the criteria for medical weight loss. It's not a magic pill. Medication lowers appetite, but it doesn't automatically ensure good nutrition, right? Without intention, people can underfuel, lose muscle, increase the risk of metabolic complications. These pillars are still important: exercise, balanced nutrition, sleep, stress management. Sometimes GLP-1s can make these pillars more accessible to people. And I think that's what's really exciting about them, especially for those who've been fighting constant hunger all their lives. So some takeaways. Uh, Obesity and metabolic conditions are very complex. Excessive hunger is very complex. It is not a character flaw. It's very biologically driven. We only have so much willpower to put into our lives, and sometimes, uh, for various reasons, hunger cues are stronger with some than others. GLP-1s are a tool. They're not a shortcut. They're not effective without lifestyle change as well. So people have the best results when they're also working with their doctor or their dietitian on any kind of lifestyle changes that might be needed with the GLP-1. There's risks, there's benefits. It's definitely a choice to be made between patients and their doctors. Um, but it's important to note that beauty and health standards are not the same, and they absolutely influence our choices on this. So something to consider when chatting with your doctor and thinking about these medications. Our relationship with food, exercise, sleep, and other lifestyle factors are still important. We have to be working on those, even if whether you're on GLP-1s or not. And more research is needed. We don't really know the effects of eating disorders, long-term consequences on our gut health, because it slows the motility of our gut, right? Um, are we able to get enough fiber and things to support our health with those low calorie allotments that we have on the medications? So long-term health outcomes, not exactly known. Exciting for some populations, probably not as exciting for others. So just things to consider. We'll send out this PowerPoint because I do have some references to some of these studies if you're interested in digging a little bit deeper into this. Otherwise, I think I kept it under 30 minutes, guys. Thank you so much for joining, and I'm going to open the chat now and let's do some questions.
I don't necessarily have any questions. Can you hear me?
I can, yes.
I've been on Zepbound for probably about 6 months. My cholesterol has gone down from 245 to 145. I'm off of cholesterol medicine. My heart rate has gone down to normal, so I'm off of those now. I've been on every diet, you name it. I've been on it. Every diet pill, I've tried that too. This has been really good for me. This Zepbound was the only medication that my doctor would prescribe for me. And I've lost 52 pounds. I'm really careful about eating the right foods. And if I go out to dinner, I don't cheat myself on that. I just eat less. And I'm about ready to, I'm down to my weight that my doctor wanted me to be, and I'm going to go on Weight Watchers after I'm done with Zepbound. But I'll tell you what, it is a really good product. I mean, like I said, I have tried everything, and this is definitely the best. So
Wow.
I wanted to share that. It's been really good for me for sure. And I feel good. I look great. The only downfall is I may have lost it too fast because I have lost muscle. I do go to the gym now, but kind of gotten more wrinkly, although I am 70. So I've earned
Oh my
that.
gosh. Well,
But
thank you so much for sharing. Yeah, that's such an incredible story. And I think a great example of how, yeah, this medication can be, uh, potentially life-saving and so effective for some people.
yeah,
So, yeah, thank you so much for sharing that. That's really exciting.
you bet.
Congratulations.
Yeah, thank you.
Let's see. I'm going to open up the chat, see if we've got any other questions here. Is it true that if you start taking any type of weight loss medication, you cannot get off of that? It's a really good question. It's not necessarily true. There have been reports of people getting off of the medications, but it is very challenging to do once you start the medication. Typically, there is like an ongoing maintenance dose that occurs. And I don't know if Leah is on, but that might be something that she can speak to if she's seen people successfully get off the medications. It's possible. It happens, to my knowledge, but it is challenging to do once you start, mimicking that hormone in your body with that medication to help with your satiety. Sometimes we see changes where the body might not be making as much of it anymore. It's kind of relying on that medication. So that might be one reason that it's harder to come off of it, but it's not impossible. People have done it.
Hi, Rachel. Yes, I do have a good bit of experience working with patients on these medications. I work in corporate health and it is covered under, their insurance. So I'm part of the prior authorization to have these patients be eligible. I mean, if they qualify, if they're eligible for them to have it prescribed. So that's great. So I'd spend 3 months with them talking about all of these changes that, you need to do. And sometimes they'll have some weight loss, as a part of those 3 months. So the lifestyle factor, I mean, I feel like that's without being said, everyone and all of the research supports all of the changes that need to be made. I have seen some patients successfully get off of the medication. And I have unfortunately seen the opposite where they are off and then, another 6 months to a year, they are, their provider's looking to start maybe a different one. So maybe if they were on Wegovy, then they're looking to get on to Zepbound or something. So unfortunately, I have seen the weight gain anecdotally with my patients. But I again, that's the thing. That's why the lifestyle education is so important because we don't know what the end game, so to speak, is. It might be for some to be on that medication long term, just like they're on, uh, diabetic medication or heart medication. It might be just some the part of your your treatment plan. But yes, I have seen patients successfully get off of it, and I can attribute that to the strong adherence they had to the lifestyle changes that are recommended with this medication.
Amazing. Yeah, thank you
Thanks,
for
Rachel.
sharing, Leah. Uh, yeah, I think it's a tool. It's not a magic pill, and when combined with lifestyle changes, seems to yield the best results. Yeah, it's a very good question. Let's see. Any good sources online for behavioral issues with food while you are fatigued and not feeling well after the medication? Wait, hold on. Sorry, I think another question popped up and I got them mixed up. Let me try again. Any good resources online for behavioral issues with food, or are these medications useful to helping with this as well? Yeah, that's what's interesting about the research is there seems to be a relationship with reduced addiction for those with like alcohol and nicotine in particular when taking a GLP-1. And it reduces the food noise. So often cravings tend to go down with foods. So in that way, it can help with behavior issues with food. So something to consider if that's something you've, struggled with for a long time. Maybe you've tried working with a dietitian, working with a therapist on your relationship with food, and it hasn't really worked for you. Then that's maybe someone who could start talking about GLP-1s with their doctor. Uh, but let's see, good resources online for behavioral issues with food. I don't have a particular website that comes to mind. But let me see if I can find something and send that out with the PowerPoint. That's a great question. Mindful eating or intuitive eating come to mind. So actually, I think that would be a great place to start. I'll send that out with the PowerPoint. Well, it's important to maintain muscle through resistance training, but what are your recommendations to keep up the routine while you're fatigued and not feeling well after the medication? Ooh, yeah. Um, with medication use, sometimes fatigue is a big symptom, along with maybe other GI symptoms, right? Nausea, vomiting. Ideally, we get those under control through, dose adjustment with your doctor, um, to help, increase your energy so that you have the energy for exercise and strength training. Um, yeah, keeping up the routine while fatigued and not feeling super well. If you've worked with your doctor already to adjust dosage, maybe chatting with the dietitian and diving into some other energy factors like hydration status, right? We know it can be easy to get dehydrated on the medications. Maybe we look at strategies to increase water intake. There's some other things that we can look at to help increase your energy for exercise nutritionally. So that might be another good step to take if you've already looked at, dosing with your doctor and making sure that that's where you guys want it. Yeah, great question. Fatigue is definitely an issue with the medication. Um, let me see if we've got any others here. I think the other questions are along the same lines of, do you have to take GLP-1s for life once you start? And not always. Yeah, as Leah said, she has seen patients come off of them, both successfully and unsuccessfully. It just depends on what lifestyle factors we have in place. And, for some people, maybe medication for life is the best way to go. Maybe it's not for others. So definitely something to work with your doctor and your dietitian on. How long do the feelings of nausea last when starting to take them? I do not know, to be honest with you. Definitely something to work with your doctor on. From what I've read, it seems to vary person to person. But yeah, maybe Leah can speak to this.
Sure, Rachel. Yeah, that's very individualized. So I just had some patients start on their medication within the past like week or two, and we're checking in on them. And so recently, two patients had no feelings of nausea. Sometimes, and the ones that do, it usually lasts about a day or so, and they don't really describe it as nausea, as maybe like a small feeling of, you know, I don't know. They say ick, a little bit of like just not feeling kind of like they're up to eating something. So in the morning, so sometimes they will drink like a protein shake or like have some yogurt or something like that, um, rather than completely omitting eating. But it's very individualized, and I have seen many patients not experience nausea. And also, if they did, they don't going forward, months into taking the medication, they don't always experience that. So again, very individualized. I have no
Nice. Thanks,
experience
Leah.
with the pill yet. I have no experience with working with any clients that are taking a medication in a pill form versus the injection. So I can't speak to that yet.
Yeah, that's a great point. The pill is pretty new. The injections have been around a lot longer. But thanks, Leah. I think we've got a couple more questions here. What happens if your medical provider is using a compounding pharmacy only? Ooh, that's interesting. Some compounding pharmacies do get third-party tested. So a company will come in and verify that their labs like meet safety standards, that the formulations they're making are the exact formulation of like the more brand name semaglutide GLP-1s, right? So that might be a question to ask your doctor, like, why are they using that compounding pharmacy? Is it a pharmacy that is regulated in some way and meets safety standards? Because that's the real concern with compounding pharmacies is they're unregulated, so we don't really know if the formulations they're making are the right formulation that your doctor is prescribing. So great question. I would ask your doctor why they're using a compounding pharmacy. Any differences in performance of the medication when taking the pill form versus shot? Yeah, great question. I don't know because the pill has only just been approved. So I don't think anyone's had an opportunity to really study that yet to see what the performance difference is. So I suppose we'll find out. It's a great question, Alan. Thank you. I wish I had a better answer for you, but with new medications, kind of have to wait for the research to really see. All right. I'll wait for just another minute or two to see if any more questions come into the chat. Otherwise, thank you all so much for joining. Uh, I hope this was educational, maybe some different tidbits to help you make an informed decision for yourself, or maybe it's information that you want to share with someone else in your life. And good luck on your health and wellness journeys. Thank you for joining us. Right. Have a great day, everyone. Bye.